Namaste everyone, welcome back to my channel. I'm Dr. Ankita Sawant, physiotherapist, and today we are back with knee joint anatomy. So it is a type of compound synovial joint and one saddle joint between the femur and the patella. So knee is the largest and most complex joint of the body. The complexity is a result of fusion of three joints in one. So it is formed by the fusion of the lateral femorotibial, medial femorotibial, and the femoropatellar joint. So it's basically modified hinge joint. So it's a compound synovial joint and incorporating two condylar joints between the condyles of the femur and the tibia, and one saddle between femur and the patella. So articular surface, for moving further to the surfaces. So here we have the condyles of the femur, proximally femur condyles, distally tibial condyles, and one patella bone. Moving further to the ligaments. In ligaments, we have first fibrous capsule. So here the fibrous capsule is very thin and it is deficient anteriorly, where it is replaced by the quadriceps femoris, the patella, and the ligamentum patelli. So basically, it's a very thin and a very lubricant kind of materialistic capsule. Next we have is ligamentum patelli. So this is the central portion of the common tendon of insertion of quadriceps femoris. So here quadriceps femoris also comes and gets inserted. Okay. So the remaining portion of the tendon form the medial and lateral patellar retinaculum. The ligamentum patelli is about 7.5 centimeter long and 2.5 centimeter broad. So it is attached above the margins and rough posterior surface of the apex of the patella and below to the smooth upper part of the tibial tuberosity. The superficial fibers pass in front of the patella. So ligamentum patelli is related to superficial and deep infrapatellar bursa and the infrapatellar pad of fat. Then we have medial. See, this is femur. Here we have tibia. Okay. Here we have patella. This triangular is patella bone. This is knee joint. So this is medial surface, medial, and this is lateral. So this over here is the medial and lateral collateral ligament, which I have just drawn here. Okay, so we'll first see the medial collateral ligament. So it's a long band. Superiorly, it is attached to the medial epicondyle of the femur, just below the adductor tubercle, and inferiorly it divides into anterior and posterior parts. Okay, so it's a 10 centimeter long and 1.25 centimeter broad ligament. Okay, so it is attached below to the medial border and posterior part of the medial surface of the shaft of the tibia. Okay, moving further to the lateral collateral ligament. So lateral collateral is a strong and cord-like ligament. So it is 5 centimeter long. Superiorly, it is attached to the lateral epicondyle of the femur, just above the popliteal groove. Inferiorly, it is embraced by the tendon of the biceps femoris and is attached to the head of the fibula in front of its apex. Okay, so it gives nice stability to the joint, medial and lateral collaterals. Okay, this side, this way, collaterals. Moving further to the oblique popliteal ligament. All right. So it is an expansion from the tendon of the semimembranosus. Okay. So it runs upwards and laterally, blends with the posterior surface of the capsule, and is attached to the intercondylar line and lateral condyle of the femur. It is closely related to the popliteal artery and is precised by the middle genicular vessels and nerve and the terminal part of the posterior division of the obturator nerve. See, whenever I am explaining things, you have to imagine with it. So your imagination should be strong. Whenever we don't have diagrams, we have to make our imagination strong. So that was all about oblique popliteal. Moving further to the arcuate popliteal. So this is a posterior expansion. See, okay. So oblique popliteal was also the expansion of semimembranosus. Arcuate popliteal ligament is the posterior expansion now from the short lateral ligament. So it extends backwards from the head of the fibula. arches over the tendon of the popliteus and it attached to the posterior border of the intercondylar area of the tibia. Okay. Now moving further to the arcuate ligaments now. Anterior and posterior arcuate ligaments. So cruciate, I beg your pardon, anterior cruciate ligament. So anterior cruciate ligament begins from anterior part of the intercondylar area of the tibia, runs upward and backward and laterally, and then it is attached to the posterior part of the medial surface of the lateral condyle of the femur. It's a very taut, it becomes very taut when the knee is in extension. Likewise, the posterior cruciate ligament begins from the posterior part of the intercondylar area of the tibia. It runs upward and forward. Anterior runs posteriorly and the posterior cruciate runs forward anteriorly. Okay, and medially, so it runs upwards, posterior runs upwards, forwards, and medially, and is attached to the anterior part of the lateral surface of the medial condyle of the femur. So it is taut during flexion of the knee. So anterior cruciate ligament is taut during the extension of the knee. Posterior cruciate ligament is taut during the flexion of the knee. Okay. So now we'll move further to the meniscus. See, meniscus are the natural shock absorbers of the body. Okay. So meniscus are two fibrocartilaginous discs. They are shaped like crescents. Okay. So they deepen the articular surface of the condyles of the tibia and partially divide the joint cavity into upper and lower compartments. So flexion and extension of the knee takes place in the upper compartment, whereas rotation takes place in the lower compartment. Okay. So the medial meniscus is nearly semicircular, being wider behind than in front. The posterior fibers of the anterior end are continuous with the transverse ligament. Its peripheral margin is adherent to the deep part of the tibial collateral ligament. Whereas the lateral meniscus is nearly circular, the posterior end of the meniscus is attached to the femur through two meniscofemoral ligaments. The tendon of the popliteus and the capsule separate this meniscus from the fibular collateral ligament. The more medial part of the tendon of the popliteus is attached to the lateral meniscus, the mobility of the posterior end of this meniscus is controlled by the popliteus and by the two meniscofemoral ligaments. So we'll see the function. It's very important now. Meniscus is really important in the knee joint. So the function of knee meniscus is they help in making the articular surface more congruent. Because of their flexibility, they can adapt their contour to the varying curvature of the different part of the femoral condyles as the latter glide over the tibia. Okay. Next, the meniscus जो है serves as a shock absorber, as I already had mentioned. They help in lubricating the joint cavity. Because of their nerve supply, they also have a sensory function. They give rise to proprioceptive impulses. So it's a really important. Next, we'll move on to the transverse ligament. So basically, it connects the anterior end of the medial and lateral meniscus. Okay. So these were all about the ligaments of the knee joint. Now we'll see the relationship. Relationship of the knee joint anteriorly, the anterior bursa, ligamentum patelli, the patellar plexus of the nerve. Okay. Likewise, now we'll come to posterior side. Posteriorly, we have popliteal vessel, tibial nerve, lateral and medial head of the gastrocnemius, plantaris, common peroneal nerve, semitendinosus, semimembranosus, gracilis, and popliteus at its insertion. Medially, we have sartorius, gracilis, and semitendinosus, great saphenous vein with saphenous nerve, and semimembranosus too. So these were the relationship of the knee joint. We also have synovial membrane. The synovial membrane of the knee joint lies the capsule except posteriorly where it is reflected forward by the cruciate ligament, forming a common covering for both the ligaments. So in front it is absent from the patella. Above the patella it is prolonged upward 5 centimeters and as the suprapatellar bursa. Okay, so below it is covered by the deep surface of the infrapatellar pad of fat, which separates it from the ligamentum patelli. The median fold, the infrapatellar synovial fold, extends backwards from the pad of fat to the intercondylar fossa of the femur. An alar fold diverges on each side from the median fold to reach the lateral edges of the patella. Moving further to the bursa around the knee. So basically, as many as 13 bursas have been described around the knee. So 4 anteriorly, 4 laterally, 5 medially. So these bursas anteriorly we'll see subcutaneous prepatellar bursa, subcutaneous infrapatellar bursa, deep infrapatellar bursa, and suprapatellar bursa. Laterally, the bursa deep to the lateral head of the gastrosthemus, bursa between the fibular collateral ligament and biceps femoris, bursa between the fibular collateral ligament and the tendon of popliteus, bursa between the tendon of popliteus and the lateral condyle of the tibia. Now we'll see medially. Medial surface of the bursas में bursa deep to medial head of the gastrosthemus. Anserine bursa is a complicated bursa which separates the tendon of the sartorius, the gracilis and semitendinosus from one another, from the tibia and from the tibial collateral ligament. So a bursa deep to the deep tibial collateral ligament and bursa deep to semimembranosus. So these were all the medial part of the bursas. Moving further to nerve supply, sorry, blood supply. 5 genicular branches of popliteal artery. Then we have 3 descending genicular branches of femoral artery, lateral circumflex femoral artery, and anterior and posterior tibial artery. Nerve supply, femoral nerve, sciatic nerve, and obturator nerve. So we'll see movements and muscle producing movements. So basically we have 4 movements: flexion, extension, medial rotation, and lateral rotation. So flexion of the knee is produced by biceps femoris, semitendinosus, semimembranosus. Okay, now we'll see accessory muscles. What all accessory muscles work for flexion of the knee? Gracilis, sartorius, and popliteus. This bracket over here are the accessory muscles according to their actions. Okay, so now extension is purely caused by quadriceps femoris, and the accessory muscle for that is tensor fascia lata. Medial rotation by popliteus, semimembranosus, semitendinosus, and accessory muscle is sartorius and gracilis. Lateral rotation is by biceps femoris. There's no particular accessory muscle for that. So now we'll move further to locking and unlocking of the knee joint, and it's really important. There might be a short question asked for you in your particular exams. So it's a very important exam and easy question, important question for the exam point of view. So locking is a mechanism that allows the knee to remain in the position of full extension, as in standing, which without much muscular efforts. So locking basically occurs as a result of medial rotation of the femur during the last stage of extension. Whenever a person is standing, okay, so knee is locked, there is medial rotation of the femur. Okay, the anterior posterior diameter of the lateral femoral condyle is less. So lateral femoral condyle's AP diameter is less than that of the medial condyle. As a result, due to this, when the lateral condyle articular surface is fully used up by extension, part of the medial condylar surface remains unused. At this stage, the lateral condyle serve as an axis around which the medial condyle rotates backwards. In essence, medial rotation of the femur occurs, so that the remaining part of the medial condylar surface is also taken up. This movement locks the knee joint. Locking is aided by the oblique pull of ligaments during the last stage of extension. When the knee is locked, it is completely rigid and all ligaments of the joint are taut. Locking is produced by continued action of the same muscles that produce extension. In essence, the quadriceps femoris, especially the vastus medialis part, the locked knee joint can be flexed only after it is unlocked by the reversal of the medial rotation. In a sense, by lateral rotation of the femur. Unlocking is brought about by the action of the popliteus muscle. Okay, so accessory or passive movements can be performed in a particular partially flexed knee. So a wider range of rotation, anterior posterior gliding of the tibia on the femur, adduction or abduction, separation of the tibia from the femur. So basically what happens is there is medial rotation of the femur. Okay, and while unlocking there is lateral rotation of the femur. This is all about the locking unlocking, and it's really important for exam point of view, frequently asked question, so do not skip this part. So that was all about the knee joint. I hope you like the video. So upcoming joint will be the ankle joint. Stay tuned for that. So thank you very much. uh, if you really like the video, please like, share and subscribe, and keep learning. Thank you and God bless you all.